Hello, everyone. Good afternoon. My name is Stephanie Johnson, and I am a community coach with the County Health Rankings and Roadmaps program. So happy that you've taken time out of your day to join us. I'm joined today by my colleague, Jan O'Neill.
Hi, everyone. Good to be here.
And we are so excited to have our guest today, Commissioner Chris Rodgers, who is a Douglas County Commissioner from Nebraska. He's here with us to talk about his work in Omaha, Nebraska. Want to give a warm welcome to Commissioner Rodgers, and how would you like us and others on this webinar to address you today?
Chris will be fine, thank you.
Okay, welcome, Chris. So first, we'd like to acknowledge the important relationship that we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And we want to also just take a moment to get you oriented to the technology we're using today. Some of this will be very familiar to some of you, but for others, this GoToWebinar attendee interface is made up of two parts. On the left side of your screen, you'll see the viewer window, where you'll see our screen throughout the presentation. And on the right-hand side, you'll see a control panel, which is where you can interact with us. Please feel free to ask questions and share your thoughts and experiences via the control panel throughout the webinar today. And we have made sure to leave time for your questions. So here's a brief look at what we're going to talk about today. We're going to start with a very brief overview of county health rankings and roadmaps to help set the stage for our topic today. And then we'll talk with Chris Rodgers about his work in Douglas County, Nebraska, and make sure to take questions to help you put this information to use into your community. This question on your screen really is a guiding question for our webinar today, and that is, how can we best engage with local policymakers to help build healthy and vibrant communities? And we'd love to hear your examples. Feel free to use the chat or question box to share what's worked well in your community, and let us know your community name so we can share that with others on the webinar. So as we move into the real content of the webinar today, we'd like you to hold these questions in your mind as you listen to our speaker and the topic of the day. And these questions include, who else do you need to share this information with? What is one idea for action you're taking from the webinar? And what else do you need to know to take action and to use this information in your community? So we're going to start with a brief program overview to ground our discussion in county health rankings and roadmaps. This will just take a few minutes. Again, for some of you, this might look familiar. For those of you new to our work, this will give you a higher level overview of county health rankings and roadmaps. And to learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars that we have archived on our webinar site. So the county health rankings ranks the health of nearly every county in every state. And for each county, you'll find two rankings, one for health outcomes and one for health factors. And this image, which I often call a picture of health, shows the relationship between policy and health factors and health outcomes. And it illustrates why it's so important for communities to take a broad definition of health. And it also shows that many factors impact how well and how long we live. So starting from the bottom, this image tells us that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. We know that there are many health factors that shape our community's health outcomes, and we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And we measure two types of health outcomes to show how healthy each county is. We look at the length of life and quality of life. Today, you're going to hear examples of policy level work that is positively impacting several health factor areas. We know this is often challenging work, and we know that communities sometimes need support to figure out next steps. With that in mind, let's take a quick look at the Roadmaps to Health Action Center. So the Take Action cycle is what we think of as the how within rankings and roadmaps. It lays out a process that communities can follow to improve health. The Roadmaps to Health Action Center includes guidance and tools to help communities keep moving through this health improvement cycle. And Jan's going to be sharing some links to tools and guides during this webinar. They'll also be posted online after the webinar. So today's webinar focuses on the Act on What's Important step. By clicking on Act on What's Important in the action cycle, you're led to this page, which identifies different resources that can help you take action. It also includes key activities with several categories of tools. And relevant to today's topic is this key activity: identify key decision makers, allies, and opponents. And that's why we're so excited to have Commissioner Chris Rodgers with us today. If you clicked on the that particular section, you'll find suggested tools. We don't have time to go over each tool, so we encourage you to explore on your own, but I'll illustrate a couple of tools that we just want to make you aware of that align with today's topic today. And those tools are Decisionmaker Analysis and Sphere of Influence. These three key questions come from the Decisionmaker Analysis tool, and it's a longer tool that can help you tease out some more complex answers to an advocacy campaign. So it helps you think through answers to these particular questions. What do you want? Why do you want it? And who has the power to give it to you? Jan's going to be chatting out links to these specific tools, so take a peek at that after the webinar. Once you know who the key decision makers are for the policy that you're looking to put in place, the Sphere of Influence tool helps you identify personal connections with the people who know the decision makers. So remember, even if you're working on a program, there are still decision makers, people, individuals who need to allocate funding for the program or make implementation a priority. So the idea behind this tool is you think about starting in the center and identify people who are those who hold the strongest influence on the key decision maker. These could be personal connections, connections that make sense, decision makers, and as you work outward, you might be looking at people with public or political influences, and the outermost circle represents those who are influencing but maybe not personally touching that particular issue. So we just wanted to give you a couple of tools to consider in your work as we lead into this conversation with Commissioner Chris Rodgers, all with the idea that it's important to carefully consider who knows whom and think about how you can build a strong circle of influence to provide information about the proposed or desired policy change to that key decision maker. Then just very quickly, I wanted to turn to another piece of our work at the County Health Rankings and Roadmaps. In the Action Center, we guide people to take action and point them to tools and guidance on our website to help with their community health improvement efforts. But we also know that there are many communities already well along the way on this journey, and we wanted a way to identify and celebrate and feature these communities. So the Robert Wood Johnson Foundation Culture of Health Prize celebrates what communities have done as well as how they've done it. Here you'll see 6 criteria that are central to the Robert Wood Johnson Foundation Culture of Health Prize. And you can learn more about our 2013 and 2014 prize winners on our site. Jan's going to be chatting that web address out to you all now. So next, I'd like to introduce you to our guest today, Chris Rodgers. Commissioner Rodgers is currently working as the Director of Community and Government Relations at Creighton University. He's the current Vice Chair of the Douglas County Nebraska Board of Commissioners and currently serves as the President of the Douglas County Board of Health, and is also the Vice Chair of the Charles Drew Health Center, a federally qualified health center in the Omaha area. He's also the past president of the National Association of Counties, or NACO, and he served in that role from 2012 to 2013, and also the father of two energetic boys ages 6 and 10. So just want to give a warm welcome to you, Chris. Thank you so much for joining us.
Thank you for the opportunity.
So, Chris, I'd like to sort of start this webinar today with you to tell us a little bit about why you do the work that you do as a policy advocate and policymaker. How do you see your role in this work?
You know, I think my overarching purpose for it is just to see a change in my community or some way to give back. I don't think anybody gets into the business is really effective in elected office and trying to look for the money. I mean, I think it's the cause that gets you in and some idea of vision that you have for your community. You know, when most people, if they see me in person, it clicks with them immediately that I was an athlete. I stand about 6'7", and weigh about 280 pounds now. My playing weight was probably about 240, but you know, I thought that I would work hard, go have an opportunity to play somewhere overseas or possibly here at home, and be able to make a good amount of money and start a foundation and steer some things toward the community. But I had an injury in the sophomore year that, you know, didn't hurt me, but it did change my style of play. And, you know, from there I kicked into plan B and started going about trying to pursue a career. In the path of pursuing that career, I got persuaded to work on a political campaign when I was between jobs, and from there I got the itch to kind of get involved from this aspect. I saw behind the scenes some of the work of some good people and what change could happen through the policy realm, which I didn't experience before, and I saw what opportunity for long-term change was. Well, after I got involved in that venue a couple of years later, I had the itch to actually be an elected person myself, and talked to a couple of peers and mentors and asked their thought. And there were a couple of offices. At the time, both of those offices were occupied by incumbents, and so I thought my opportunity to go that route may wait or may not come at all. Coincidentally, a month after that talk, there's an article in the paper that says a person is resigning from one of those seats that I was inquiring about, and that the appointment was going to be up. The appointment process in some places is just political as an elected process. And so I went about the route of trying to cross all my bases and get elected to the seat, and was told by several people that the board I serve on now, the county board, a member at the time, her son wanted to be appointed to that board, and the interests that were heavy aligned with that owed that person. So, you know, I was told that they couldn't do it this time, but, you know, let's see what happens in the future. And because of the power of this name of this person, who's to know that if I would have ever ran for office because of the name of that person, what that name held. Well, when the appointment process got forward, it seems that the boundary line, which was a street, this person lived on the other side of the street, which made that person ineligible for that district and put me back in play. And that's what, you know, put me back into the form of trying to give back through the elected realm. I mean, I definitely try to give back and for the cause, but, you know, there's a part of me every day that thinks that, you know, the path I'm on is more fate and divine intervention than anything, because who's to say if that opportunity came, if I ever would have went after elected office again.
Thanks, Chris. It's always so fascinating to me to learn about our guest's professional journey. Can you talk a little bit about your connection in the juvenile justice realm, and maybe then tell us more about your community that of the Omaha area?
The Omaha community is, the state of Nebraska has about 1.8 million people. The state, our county, Douglas County, makes about a third of that state. We're about 537,000 population. Douglas County has certain controls, and it's said in the county world that if you've seen one county, you've seen one county. And what had happened over the years before I got on the board is that we were, starting to move in respects to juvenile justice, and we were starting to move in the realm of public health. And those are two areas that our county has distinct jurisdiction in. I got involved from the juvenile justice realm in respects to trying to keep kids out of detention, but as I went forward and getting into that space, it ended up being more about health and public health. And so when an opportunity opened up on our Board of Health, in our state statutes, one member of the Board of Commissioners is designated to be on the Board of Health. I asked my colleagues for the spot and got on and began the process in regards to learning how influential public health is in some of the realms of juvenile justice and the whole circumstance about the social determinants of health and how all that plays in, and how health is kind of like a foundation for a lot of things that we're dealing with. So that experience with juvenile justice actually put me on the track to getting involved with public health.
Great. Thanks, Chris. One of the things that I remember you sharing with us as we were planning for this webinar is some of the work that you did with your role as a policymaker in the context of our model. So I put this image up, and I'm wondering if you can share with us an example of policymakers' work in the context of our rankings model.
Yes, if you look at health behaviors, as I mentioned before previously, there was a lot of work going on in our health department, in public health in general, in our county around the early 2000s, and that work was going on because we at the time were per capita the leading county in regards to STDs across the country. And when I got on the board, elected in 04 and got sworn in 05, in 03 or 02, I was working in the mayor's office and watching the issue, and the Board of Health at the time declared an epidemic in regards to our issue with sexual transmitted diseases. One of the biggest issues we had was getting a gain on what actually those numbers were, getting some measurement, because at the time we have 93 counties in the state. The two counties of most urban population, Douglas and Sarpy County, to our neighbor, were not participating in the youth behavioral risk survey. They did at one point, but because of a bad experience with the publications, particularly the lead newspaper here and how some of those numbers were portrayed, it burned them real bad. And so by the time I got on the board in 05, it was this constant battle to try to get the biggest school system in the state re-engaged into the YRBS process. This was 05. We talked, met, tried to devise a strategy to be able to have the YRBS distributed in that district. Every opportunity we got, and it built around a couple of things. One is, timing. Two is relationships, and the other is just the fact that when the policy window opens, it opens. For my period in the first 2 years, I was on a committee at the Board of Education, and I would always mention this to the superintendent and try to get the ice to thaw. It was one of these things where, in not a badgering manner, that I would always talk to him about it and try to educate him about it. The director of our Board of Health would always talk to him about it when there was an opportunity and see if their stomach had changed a little bit to get in to take the test. Just so happens around around 2010 or so, the atmosphere in our community just changed a whole lot. We're big on public-private partnerships here, and at that time there was a big movement with the Federal Qualified Health Centers and a foundation here to try to put health into all the schools. One of the things I didn't note about our county's makeup is that there's 11% African American and 11% Latino, and depending on where you're at, you can see where the concentration of those populations lie. And at one point we had, in an article, it was talked about the levels of poverty that we had at childhood poverty at high levels. And so the foundation had really wanted to try to get at health care and things going on in school, going on with kids' health. And while they were missing schools, and the place to go was the school system, well, through that breakthrough with the school system, just in respects to health coming in through the federally qualified health centers, the school board thought a little bit in respects to health even coming into schools. When I first came on, they weren't really admitting to the fact that health had its place in education. And through time and with this project and this partnership with the federally qualified health centers, Charles Drew, One World, and at the time I think the Sherwood Foundations and an Epicor building, Bright Futures, they were able to get into the schools and have some of that thought come across. At the same time, in addition to us constantly talking to the superintendent, we were fortunate enough in 2009 to win a grant, the CPPW grant. In regards to, we got $5.9 million, and one of the requirements from that was to have a modified YRBS. With that, we did get the school districts to buy into a modified YRBS that did not have the sexual questions to them, but geared themselves specifically toward health. And along that path, in addition to the timing of health making its way into the school system, the Board of Education getting more comfortable and educated with it, the trust was able to build with the partnership that we have with the school district with the CPPW YRBS assessment, and over time the relationships just built with the superintendent and the board, till the point that 4 years ago the board had an agenda item on, and one of the board members out the blue made an amendment to that item that the YRBS be added and that it be distributed to the school district. Without debate, you know, the amendment passed, and with that point, the YRBS was back on the table for us as a health department, and we were able to get some very accurate data. But, you know, the thing that happened with that is, one, again, I can't stress that sometimes timing happens. The policy window opens, things open up, and when that happens, you have to be ready. And we just didn't last minute. This was constant relationships with the superintendent, the board, constant education, constantly talking to them, and having a lot of allies in different places. We had allies with the federally qualified health centers that didn't hurt us at all. So by the time that, you know, that window of opportunity opened, we didn't come in at a crisis moment. We had a relationship, built some trust, and when the window opened, we were able to get it passed, and had YRBS there. And it's, I can't you know, all politics is local and it's all relevant, and I can't underestimate the mammoth task that getting YRBS was. I mean, all over the state, we were talking about, do we need to have state legislation to mandate it? But over time, it thawed, and the right opportunity came.
Right, right. Well, Chris, you really illustrated that the power of building trust and relationships, and that can take time, but using your allies and sometimes being patient with the process is an important part in advancing policy. For those of you who may not be familiar with the YRBS, that is an acronym for the Youth Risk Behaviors Survey.
Yeah.
And it is something that many school districts around the country use to survey the students in their school system on a variety of different risk behaviors. So just wanted to make sure, sometimes in our work we use a lot of acronyms, and want to make sure that everyone is clear on what that YRBS is all about. So let's talk a little bit about this concept that you mentioned a moment ago, infusing this health in all policies approach. And I know when we were talking about this, there was an example of some systems work internally that you experienced at your local health department. And I'm wondering if you can share with us a little bit more about that, I guess, that philosophy of infusing health in all policies.
Yeah, I mentioned that in the last example that we had the CPPW grant, and one of the things that we had during that grant was we had a goal of trying to make small and big P policy change throughout the county. One of those pieces that we wanted to really get into was the environment. CPPW grant had us really look at food policy around. We had done GIS mapping in respects to what areas may be described as food deserts, what areas may have issues of health insurance or issues of chronic diseases. One of the 5 priorities for our health department over the years has been diabetes and the cardiovascular disease. So when we did the CPPW grant, we talked about food deserts, but also there was a plank in there in regards to community planning. When I
Chris,
mention, yes.
Excuse me for interrupting. Could you help us with the acronym, the CPPW, for those who may not be familiar, and maybe just talk a little bit louder so we can hear the full strength of your message and voice.
Sorry, I'm right up on it. And to your point about the CPPW grant, I have been trying to, I don't know offhand, I think, what the acronym is, and I'm embarrassed to say I don't know that as many times as I've dealt with it, but I'll just say it was a grant through stimulus money from the First Lady's Let's Move campaign. And
okay.
So to give some people a range for that respect.
Okay. We just learned that it's the communities putting prevention to work.
Exactly.
Communities putting prevention to work through the CDC. So
yes.
We will never forget that now.
Yes, and so basically to the story, one of the issues we were trying to get at was infrastructure and planning. I had mentioned in the last example that over time we had built some relationships and we build relationships over time. Well, over the time on the board, our Board of Health has been having a real hard discussion about increasing our policy expertise, our policy strength. We had a lot of people in positions there that knew their craft, but we needed to really see if we can change and move the dial on policy. So we brought members from the school board, a member of the city council onto the board so that we could have some understanding and interplay in the planning that goes on. Through that CPPW grant, one of the pieces was trying to really get bikeable trails, walkable communities in those areas where things weren't there. And so as time went, we built a relationship with the planning department. We worked very close with our planning department in the city of Omaha in respects to trying to work with them on ordinance changes, development that comes through the planning board, to the point that over the last couple of years, we have brought on a position full-time in the health department that works with communities and the planning department in respects to when a development or a project is being in there. We've worked with the community to kind of get an idea of what they would like to see from aesthetics, from what they would like to have in the community in regards to walking paths and things of that sort. And a lot of that early work has been incorporated into the planning board's work when they get ready to approve plans. The result of that now has been our health director is a member of what we call a Complete Streets Project, and a member of our Board of Health, who happens to be a city councilman named Chris Rodgers, has led the effort from the city council for a Complete Streets Project. And basically what that is the health and all approach, I think, to infrastructure. The Complete Streets Project is in form of policy in the city of Omaha that talks completely about bike trails, walking environments, things of that sort. And so over time, through that early work with the CPPW grant and our work in just trying to make sure that those things have come to fruition in time now, I think we set ourselves up pretty much to be an influential voice from a public health perspective in regards to planning in the city, roads, bike trails, and all other matters that may affect neighborhoods and things around.
That's a really great example of infusing that policy emphasis throughout the built environment as well, and I know that some of the work that we are doing with communities is really focused on the built environment. Talk a little bit about the community change work that you have been a part of, and specifically I love the example you shared with us during our planning calls on the Empowerment Network.
The Empowerment Network is an entity that was modeled off of an inclusion project by Tavis Smiley, who's seen mostly on public broadcasting in some places nightly. In 07 and 06, Tavis wrote a book called The Covenant with Black America. The district I represent happened to be about 55% African American, and for a while, as I said, there's big public-private partnership push here. I was approached by a gentleman named Willie Barney, and in conversations with some elected officials, we try to create a common agenda. I mean, now it's modeled more so, and you hear of its collective impact. At the time, we didn't know that. We were sitting around trying to get a common agenda off for certain areas in our community. And in 06, in the fall of 06, for a period of about 3 months, we had to meet weekly for about 3 to 4 hours every Saturday morning, coming together to try to bring this agenda together that focused on housing, criminal justice, education, jobs, and other matters that were key to the community. So with that, the Empowerment Network was born, and weekly, where there's meetings on crime prevention, monthly there's meetings with the community where feedback is given up in respects to what they think are the issues and how do we guide some of those issues. It's frankly made it a whole lot easier on us as elected officials that represent that area, because we have a constant input of what the community's needs are, and it helps us target our direction in regards to focus and what community members may want. And it gives us a chance to really get on the ground. It gives them a chance to build relationships with us, things of that sort. So, the Empowerment Network has been this real bottoms-up, grassroots, collective impact approach that helped us really target what's going on with the community. Right now, in regards to public health, there was a health plank in there, and us as the county, Douglas County, and the Board of Health of Douglas County have taken on the health plank in some regards, and we've tried to, through data-driven analysis, focus in on zip code 68118, which statistically is one of the most poverty-stricken areas in the district, and we're going at that one zip code at a time to try to really make a dent into some of the public health issues that are going on in the county. And it's in partnership with the local FQHC, our Board of Health, other areas in the county, and other community-based organizations to really, with community input and a bottom-up approach, and with policy driven ideas to try to change the policy and attitudes, try to really make a change in some of the public health issues around Douglas County, and particularly Northeast Douglas County.
And it looks also like that specific violence intervention and prevention strategy in the Omaha 360, which is what we have here on the screen, was one of the sort of implementation strategies that you were working toward.
Yeah, and I reduced it a little bit for time, but I'll elaborate a little more for you on the 360 piece. 360 meets every Wednesday at 2 o'clock. In partnership with the Omaha Police. There's a community partnership where the police work with the community weekly to give them an idea of hotspots, opportunities where they can help the police and the community talk about issues that may be going on in neighborhoods, like what events are going on. Do you think there needs to be some support there? Kind of provides a little intelligence both ways in regards to what the police need help on, and also gives neighbors an opportunity to address their concerns with police and where they think opportunities may be. It's been good, quite frankly, in regards to reducing and setting a relationship up, particularly in a year like we've had this year with the Ferguson, Missouris, and Baltimore. It's helped us to kind of rid an atmosphere that's intense as that, but it's also given us a lot of opportunity to address issues. I mean, one of the things that I know has been talked about in there with law enforcement is that there's a certain amount of crime reduction that can happen with just law enforcement, and a lot of the other things has to happen through job programs, community support, and other things. So it's a concentrated effort every week to talk about data to get a real hand on what's going on and kind of exchange some information on what next steps will be with the community and our police force.
That's so great, Chris. I appreciate you diving a little deeper into that. And speaking of data, I'm going to go back a slide to this map, and wondering if you can talk a little bit about this map. Jan has a question that has come in from one of our attendees, so I'm going to allow her to ask this question for you.
Okay.
Yeah, so Chris, the question was, what factors and data were used to develop this map? Could you talk a little bit about that?
Yes, this is, you see at the bottom, it talks about food, vegetable consumption, obesity rates, physical activity. We use this map to try to get a idea. Well, let me say first, there were five areas that the county has as a priority is child, maternal, infant mortality, cardiovascular disease, diabetes, STDs, and health disparities. This map speaks to about 3 of those issues. The intensity of each one explains issues with the highest potential for impact, and as you see, that darkest area makes up, some of that portion makes up the 6811 project. Those areas where it's most intense are where some of those issues are. In respect to those things at the bottom, high, where they cross with high obesity rates, not a lot of food choice in regards to fruits and vegetables, and also the physical environment not being the best for activity. And so you also note on there that these are also some of the most intense poverty areas by the darkness of the shade and some of the density where people are. So, you know, from this we tried to really narrow in where some of the issues are in the county and where prospective spots was, and how do we target trying to address policy issues and other things in those areas.
Yeah,
Hope
right.
And
so also the sources are on the map on the left. This is where you pulled from that. And I'm wondering, you said you used it to shape policy. Could you talk a little bit more about the interactions, if there were some, with the Omaha 360, you know, with the community organized group? You know, how is this data used to help shape policy that has community voice in it as well?
Yeah, one of the things when we wrote the grant, we wrote in partnership and an amount of money in the grant for the Empowerment Network. Omaha 360 is used as a term for more of the crime prevention pieces, and the Empowerment Network is kind of the umbrella for it. So when we wrote this grant for the CPPW, $30,000 went to the Empowerment Network to work with institutions to help us as a health department work with institutions in that darkened area. For instance, I know there's 2 stores particularly where we work with them on just one, some of the grant money was used in respects to helping them to be able to maintain perishable foods and of sorts. You know, for some, we work with them on signage. There was a lot of technical assistance with the health department in respects to displays and making the fruits more visible. I mean, little things in regards to signs for healthy food stores, putting the fruits and vegetables more up front and giving people a choice in that respect, and helping some stores access healthy foods and vegetables to some degree, and helping them to some degree with some grants be able to acquire some of the equipment and things to be able to maintain healthy fruits and things in their store. So what we did with that data is to, one, work with the Empowerment Network to get on the ground, to get a feel, and we work together to provide technical assistance to those stores in need based on feedback from the community of what they would like to see in their store. Would they ask them would they eat those choices if they were there, and what things would make them more likely to eat fruits and vegetables if they were available to them.
Great, Chris. Thanks for expanding a little bit more on this question from one of our attendees. And I know that there are many of those on the call today who are interested in this question or this topic, which is how to engage with policymakers. And one of the things that I recognize in some of the questions is what is the best method, I guess, for reaching out to policymakers, and how can policymakers really affect change? So I want to give you some opportunity to talk a little bit about that big question of engagement.
It's not rocket science, but engagement is, I think to me built on three things. I mean, I think there's a way to engage, and the best way is to, one, I think, don't have your first contact be with crisis. Sometimes it's unavoidable, but I think, just trying to reach out to your policymaker and get to know them and become a resource for them is the best way. They're your representatives, and I would just, one of the rules that was given to me when I first got into working for a mayor was, if you have a meeting that's an hour, it's 30 to 40 minutes too long. And I guess you should never go into a meeting with a policymaker, expecting to be there an hour. You can effectively get what you need to get done in about 20 minutes, and I think that should be, introduction, and also you doing a lot of prep. The great Bill Russell, known as one of the best winners in history, wrote in his book, one of his books, that he not only did a scouting report on his opposing team, he did a scouting report on his own players, so he can know what their strengths were, where he could put them in the best position, things of that sort. Now in addition to not contacting a policymaker, in crisis as your first contact, you need to do a little research on that person to really understand what makes them click, what would be their interests, and just, set up a brief meeting, introduce yourself, tell them a little bit about what you do, and just, make yourself available as a resource. And I guarantee you in some time, they'll remember that and reach out to you if they need you in that time to help them with policy and things of that sort. We're always looking to some degree for a resource, some type of academic resource, or somebody with some expertise to try to help us flesh out issues that we may be dealing with. And I think the last thing is, in addition to not having your first contact be a crisis, really do some research and understand the person you're dealing with, what makes them tick. Third part is trust. Always, try to establish some trust, meaning, never, never, never lie to them or us, because that just puts it in doubt all the time. And I don't care if, small things, just keeping them up to date on tweaks, always being upfront, never letting there be any surprises. That will be appreciated. Don't have yourself in a situation that data or information that you provide to someone is not what it is, and don't clean up or give some parameters to the information you're given, because that trust is important. And I think those are some of the three basic foundations to establishing that relationship with the policymaker that will help everything else become a little more easier.
Sure. Very, very good points. One of the tools that Jan's going to be chatting out is something that we've used with communities, and it's called the 2793 tool, something to help develop a persuasive message. And the 27 stands for 27 words, shared in 9 seconds or less, and 3 main points. And so you've given us 3 main points of how to best engage with policymakers. And for those of you who may be looking for some help in crafting a persuasive message that may be that sort of entree or lead-in to communicating with policymakers, check out the 2793 tool. Is there any sort of specific policymaker speak or specific language that you have found really, I guess, perks your interest or kind of makes you listen a little bit differently in your work?
I would say um, that's individual to each person. But what I would say is, one, keep just try to keep abreast of current events, even if you have to look through that public pulse area of your paper, the editorial of your paper, the local, ours is a Midland section, or that local section on what's going on in the paper. Keep abreast of that. So timing. I mean, sometimes there will be, in addition to what I said about researching your person and knowing, try to keep abreast of what's going on at the county board meeting, even if it's more of just looking at the agenda and seeing what topics is there. You might not be able to watch them every week, but if you got an idea of the topics, you got an idea of the current events, over time you will see when those policy windows open with those particular people on the board, and everybody on the board has their interests. They have committees that they chair. I guarantee you the chair of a committee and those committees that they're on will speak to what their interests are, because they want to be involved in those committees that have a heavy influence on policy and other things that affect their district and their interests. So those things will give you staying abreast of current events, watching the agenda every week, and getting an idea of what committees your representative or county commissioner or council person is on. They're telling you right there on those committees what their interests are and what they want to have an effect on.
That's great. Thanks so much, Chris. I want to make sure that we have time for more questions, so I just want to move us along and again bring us back to these reflection questions that we shared at the beginning of our webinar, and thinking about what else do you need to know to take action and use the information that Chris has shared with us today. And now let's see if we can answer some of your questions. I know Jan's been watching the questions come in, so I'm going to turn it to Jan, and go ahead.
There's been some great questions here, Chris. I think you're generating a lot of interest here and hitting on all the points, many of the points that people wanted to talk about. One that maybe we can tease out a little bit more is you already had an interest in health. So how do we build political will with those who perhaps don't see health as a priority and perhaps don't see it as globally as you see it with the big H health, focusing on social and economic factors along with all the other factors? How do we build that political will? Just a little question.
No, I think one thing is that was mentioned earlier in the example is patience. One, be patient with it. Two, to your point of the outline that Roberts Woods just laid out in regards to how to communicate, try to get it into a one-page format, and give them links or things to go get more detail. It's not going to happen overnight. Believe me, things click. I have certain things that trigger me, and when I see them and I know they may be of interest and I can't get to them, I put them there for another period. And when that issue all of a sudden hits, I'm looking for that piece of paper. And sometimes with the really good people that are tuned to it, while I'm looking for that piece of paper, I get an email with that piece of paper attached, just saying, hey, I saw this there. We talked about it earlier. Just wanted to put this back to you, and I guarantee you if I couldn't find that piece of paper, I was on the phone with that person. It's a continual relationship. Don't just do it during crisis. Once you find, as I mentioned in the earlier piece, in the previous question about their interest, everything that you see that may trigger that person you want to get to their interest, you should, there's nothing to say. You clip an article and just drop them a quick note. Hey, you get time free, if I could just talk to you a little bit about this article, just every opportunity that you can to drop them information on the subject. Once you've established that meeting with them, they may use it, they may not, but the thing is, one, you're connecting with them in a non-crisis mode. I guarantee you they're seeing it and identifying that issue with you, and when the window opens, it'll open big, and hopefully you're top of mind, or at some point that person will make contact with you. So it's a it's a cultivation. It is it's a date to some degree, and You know, if it's not rocket science, if you just go there from that point of view, you'll get there.
Yeah, it's really, you're talking about the art of persuasion and long-term relationship building, it sounds like. And don't just assume because you drop off a talking point once. Right, it's over time. And as you said, cultivation.
Unless you grew up with that person on the
Mm-hmm.
same block and you're their next door neighbor and you all been lifelong friends, you know, you're just not going to have access like that. You got to build it over time.
Which goes back to that sphere of influence tool that Stephanie introduced, which is if you don't have that kind of relationship, somebody does. And so you probably know, if you're in your community, you know somebody who knows somebody who knows somebody. So working that sphere is really important.
I agree.
So another question that came up was, and maybe this gets at your point about the policy windows. Do you have suggestions for how to prioritize a policy agenda when there are so many items on any policymaker's agenda? There's so many items. How to help prioritize?
One is I think each individual person has their, let me organize by saying three things. One, you have to know each individual person's drive, and that dictates the window. Understand the district that they represent. And I guarantee you, in addition to what may be the general overtone of the county, they're always trying to work their personal issue into it. For instance, let's take Congress, for instance. You know, nationally right now, it's all about, you know, Iran, but in the beginning of the year, the State of the Union kind of sets out where leadership is going. I think at the beginning of each year, particularly in your legislative sessions or somewhere at the local level, there's this moment of State of the Union or issues that are in the paper, and you know which items are going to be priority. You know, a lot of the times, priority is not dictated by that person. Priority is dictated around the circumstances that are around you. And you, back to the paper and watching things, you've got to be just tuned into what's going on in your community. I guarantee you, on a lot of the agendas around the country, you know, from a county perspective, criminal justice is one, economic development is one, transportation is one because of road funding, no doubt about it. The question is, where do you make public health relevant in those realms? Again, for transportation, it's a health and all approach with infrastructure. How do you tie that together, and how do you help provide that person information on there? And that has to be built over time. If it's, you know, public, if it's criminal justice, right now one of the biggest issues is mental health. How can you tie ACEs and adverse childhood experiences and things to mental health in the justice system, or even how it plays out, things of that sort? You have to be attuned to the paper, to the agenda, if it's a county executive or where they're trying to make their priorities, and then what issues of the day will pop up that take priority.
That's helpful, Chris. I think what I'm hearing you say is it's really as much about listening and watching for the right time, and then having, as you said, back to cultivating it, just knowing that you're going to be there in the right time, in the right place, and that these agenda items will come around. Plus, we heard you talk about building your relationships with many different sectors in your community.
Yeah, you steered me to it, and I guess the one thing I would add to that too is, and thank you for steering me to that for one more point, you should, if you have your issue, you should have it you don't have to have it all the way thought out, but at least have it in a form where you can present it. It's better to be ready and not have opportunity than have an opportunity and be ready. So I think whatever you're trying to do to some degree, you should have some thought to it, and at least have a shell of it where you could talk about it, because when the window opens, you want to be able to move with it.
Great. Well, we have so many questions here, and I wish we had another half hour to talk with you. But I guess that, you know, since this is a webinar about working with policymakers, there is another policymakers questions. There's also a lot of questions about that potential impact map, so maybe we can take some of those offline. But the question about policymakers is working with the school board champion and getting those folks involved. So, I think some people, I think you've talked to this during this whole webinar, Chris, but I've often heard people are struggling a bit with how to partner and how to get with school-based champions. So can you talk from that perspective? You were on the school board.
I felt like I was on the school board.
Oh, you felt like
but
you were
I hung
on the
out there
school board.
enough.
Okay.
I hung out there enough. What I did, and this is the approach that I've taken to some degree on everything. Luckily, I have a job where I'm a government relations director, and me working and studying up on issues kind of works hand in hand with the county role, and I've always had some flexible jobs in that respect. To build it with the school boards, usually in a lot of places over the country, superintendents have such a strong hand. They're not members, but they really have a strong hand in what's going on. So I think the cultivation is not only with building a relationship with the administrative leadership, but also the policy leadership to some degree. And that, quite frankly, it could be built on volunteering your time at a particular school, getting a relationship with a particular principal that can probably help you with access. For me, it was volunteering on a bond accountability committee and taking leadership in it. And that's, the route that I went through with mostly every issue that I've tried to get on. I've tried to get on that board or some advisory committee of that board to really understand the inner workings. One, to show that I'm really trying to dig into it, but one, to give me an opportunity in the room to build some relationships with the players and be able to connect the dots at a farther date. So I don't know the politics of your local school board, but I do think, building a relationship with that school board member, but also at the same time building it with the administration leadership, because they're going to work together somehow eventually.
Great points, Chris. Thanks so much. We unfortunately don't have any time for additional questions. I'm going to start wrapping up the webinar now. But wanted to let you know that thanks to the support of the Robert Wood Johnson Foundation, we have 11 community coaches. 4 are based in Madison, Wisconsin, and 7 are located regionally around the country. And we are available to assist communities at no cost to help them move through the challenges of the work of community health improvement, to help strengthen community leaders' capacity to advance health improvement efforts. And you'll find these orange boxes that you see on your screen located throughout the Action Center, and those are really meant to invite you to contact us for help. So this is the best way to contact one of our community coaches, and don't hesitate to reach out. I also want to let folks know that we are recording this webinar, and this will be archived on our website as we do all of our webinars. But we do have an upcoming webinar on August 4th called How to Tell Your Story, and it's really going to be a very engaging webinar with folks from Rochester, New York, talking about how they harness the power of storytelling to advance health improvement efforts. So it's going to be a mix of some data and the role of data in storytelling, but then also, advancing advocacy and policy change. So encourage you to register for that August 4th webinar. Use social media to stay in touch with us. We would love for you to follow us on Facebook and Twitter, sign up for our e-newsletter, and just acknowledge that our program is the result of contributions of many, many partners, including the folks listed here. And at the beginning of this webinar, we introduced this guiding question, how to best engage with local policymakers to build healthy and vibrant communities. And I hope that this discussion has generated some new ideas and some thoughts for you about how you can engage with policymakers to help build a culture of health in your community. And Lastly, but certainly not least, we just want to share a generous and heartwarming thank you to Chris Rodgers for sharing your story, Chris, and for giving us some really great insights about working and engaging with policymakers. And we hope to see those of you who've joined us today on future webinars. So with that, I wish you a great rest of the day and week. Thank you so much for joining us.